able to pick your favorite topics and spend some more time with our local experts, kind of doing a deeper dive than what you're going to see in the 5-minute presentations this morning. I do want to share some facts with you about ACS for those of you who may not be familiar with the organization. It was actually established in 1963. It has over 150 members, primarily made up of nonprofit organizations, government agencies, businesses, and community advocates. ACS was instrumental in, as I had mentioned, in developing this collaborative and is also responsible for the management of the collaborative. Our very hardworking manager, Terry Auger, is there in a lovely peach outfit in the back. And she is very instrumental in keeping us all on track and running the department here. ACS also publishes and distributes over 20,000 guides to community services, which is the annual directory of ACS memberships, and it's widely used throughout the county. You may have seen it. ACS also advocates at the local and state level on legislation that impacts the nonprofit members and those that they serve. We also inform the public about needs in Howard County by researching and publishing the annual self-sufficiency indicator report, which will be part of the materials that you'll be receiving in connection with today's session. And Laura Sylvanik is one of our board members and also is very instrumental and leads that effort with another public policy member, Jackie Yang. ACS also provides education and training programs, including best practices on a variety of topics, ranging from program evaluations, board governance, and fundraising. We also hold annual membership conversations with elected officials, so you all may be coming back here, hopefully, to chat with us. We have a wonderful mentorship program, and we also have exec-to-exec sessions. ACS also connects members through a variety of networking opportunities and events. We annually honor volunteers and employees who go above and beyond the call of duty at our annual Audrey Robbins Humanitarian Award, so hopefully again we'll be seeing many of you at that event. And we inform members through our monthly Member Matters newsletter, and we have a wonderful, highly appreciated jobs openings email. Today, we've been asked to attend this important event because we recognize that you as leaders in our community will be among those who shape the future. We want to share with you information and a few important facts about the issues that are going to be discussed today that are being confronted on a daily basis by the nonprofit community. Each of you should have been provided with a blue folder that contains a set of one-page summaries of the critical issues that we're going to be talking about today and some potential opportunities. Our topics for today include human services, health, workforce development, which will also include things like affordable childcare, affordable housing, and also transportation. We don't have a transportation person with us here today. She was unable to attend, but you have the information, and you also have her contact information in the materials that you've been providing. So we're going to have leaders from each of these sectors provide you with a 5-minute overview, and then following those presentations, as I mentioned earlier, there'll be an opportunity to have more in-depth discussions at the tables in the back. And the tables in the back are set up around 3 topics: health, workforce development, and affordable housing. We'll hopefully try to stay on schedule and provide you with 2 20-minute discussion sessions. Now I'd like to introduce Joan Dreesen, the Executive Director of ACS.
First, thank you all so much for taking the time to be here today. I know that you are invited to so many meetings and forums and debates that I truly appreciate you taking the time to be here. I will add to what Grace said by saying that this PowerPoint will be on our website. All of the materials that are in your folder will be there, as well as some additional resources. And we hope to have a videotape of this presentation up there as well. So if you'd like to refer back to it, please do. Also, we have contact information. If you have questions that aren't answered this morning or that you think of later, please call us. We would love to be a resource to you. So, without further ado, I'm going to talk very quickly and very briefly about human services and some general facts about our nonprofit sector in Howard County. Nonprofits are often not thought of as an important component of our local economy, but in truth, we have 8% of the employees in the county and account for 9% of the wages. We are job creators, we purchase local goods and services, and we pay taxes. Moreover, our programs and services support the residents and employees and help to create the great quality of life that we so value in the county. The range of operating budgets for local nonprofits is very wide. However, the vast majority of them are very small, with 2/3 of them being under $25,000, which means they probably have no paid staff, and with 87% having budgets under $250,000. There are many challenges for nonprofits, wherever they're located, but particularly some that are particular to Howard County. Because we are a wealthy county, we have difficulty attracting regional and national monies, funds from larger nonprofits. They will say, come mind your own backyard. We have a very small number of local funders, Community Foundation, the Horizon Foundation that funds primarily health, United Way, which does some donations as well. And then we have the County Community Service Partnership grants, which really provide money for basic needs. However, business costs are just as high for us as they are for anyone else. The nonprofit collaborative here has tried to help to defray some of that, but it's expensive to operate here in our county. We need a robust infrastructure to maintain our services. And salaries and benefits are an issue. We try to attract very well qualified folks, but they have to be operating for the passion, because largely it's not going to be for salaries and benefits. So it can be a challenging environment for all of us. But we are fortunate in this county that we do have a really strong network that works together, I think, pretty darn well. Government works well with our nonprofit agencies, both civic, faith-based, and the nonprofits you see here, as well as for-profit businesses. Some of the examples might be in the area of children and youth. That first bullet point you'll see the school system, DSS, the Child Advocacy Center, Park and Recs, the Office of Children and Families at Community Resources and Services, all government agencies that work well with our nonprofits like Voices for Children, Family and Children's Services, FERN, Columbia Association, as well as various youth programs and ministries. And then we have our businesses, our child care providers, our mental health counselors, our tutors. And it is a very tight network. There is a lot of coordination, both formal and informal, between them. In the area of housing, you can tell there we have Housing and Community Development, which is a county office, Community Resources and Services, kind of our quasi-nonprofit, the Howard County Housing Commission, and then our nonprofits like Grassroots and Bridges and Habitat for Humanity. And Cindy, I won't forget the Arc of Howard County, wherever Cindy Parr is back there.
Thank you.
And we have multiple faith groups who host the cold weather shelter in the winter, and we have our day resource center, as well as businesses like our nursing homes and assisted living facilities. Services are accessed in a variety of ways. The directories, like you have in your folder there from ACS, but the county also produces a number of directories that both clients and service providers use. There are also a number of information and referral networks. We have something called the CARE app, which was developed by the health department, that provides resources. That's for service providers, but there's United Way's 211 that can be called by any resident, as well as the Maryland Access Point, which is primarily for older adults and folks with disabilities. There's word of mouth, which is often how things happen. And then there are referrals between the organizations. We have a pretty tight-knit community in the nonprofit sector and in government, and we work well together. So a lot of things happen by word of mouth. And then there's the issue that I think is key, which is coordination. Most of the time, people who are in crisis don't have one need, but they have many needs. So how do we coordinate it? Sometimes it's informal. We just know each other. We've had similar clients over time, and we just talk with one another. But there are formal mechanisms as well. The coordinated system of homeless services might be the best and most coordinated example of that, which has brought together a number of service providers who each have kind of a choreographed responsibility within that coordinated system to serve people who are near homelessness. There's also the CARE app that I referred to, and there's co-location, like here. It is easy for us to coordinate cases when we're in this same building or on this same campus. There's also, we are piloting at ACS, a navigator, who, when clients come and they have more than one need, she uses the CARE app and is able to make the referrals to other places. Now, the CARE app is unique. It allows you to refer and to track the contacts that were made. Challenges for service providers, there are many. One of which is there is always an increased demand for services. And part of it's just the outreach. The more effective we are in outreach, the more clients we see coming through our doors. The complexity of cases. If you look below the surface, it's usually not just the presenting need, but there's a whole host of others that you need to deal with in order to help the person become stable. Funding that limits the flexibility. Oftentimes our funding is tied to a specific program. It might not be the greatest demand, it might not be the most pressing need, but the funding is limited to serving that particular need. And then we have a very diverse community. It's wonderful for our county, but it can make it more complex. We have to be sensitive to issues like culture. We have to be sensitive to languages, and we have to be able to translate. We also have an older population that's exploding. I'm a mama, so I know. And that's going to mean different needs and increased needs. And then there's a lack of awareness in the county that the needs even exist. I mean, we do a really great job of saying we're the best, we're within the top 10. And I think we overlook sometimes how many folks within the county have real need. And then there's the high cost of self-sufficiency in the county. It's expensive to live here. So this just gives you a sense of how expensive, of what the wealth looks like in the county. 22% of our households in 2016 had an annual income of less than $60,000. $60,000 is less than 50% of the median income in this county. And 10,500 had incomes of less than $30,000, which is 25% of the median income. This next slide shows you what it really costs to live in this family. And this was done by the University of Washington. And unlike the federal poverty guideline, which says it only costs about $24,500 for people to live, for a family of 4 to live, this takes into account far more measures. Things like transportation, childcare, healthcare, housing. And so you can see for a single adult, it's around $35,000. For a family of 4, which is 2 adults, an infant and a preschooler, it's over $101,000. Now, I will tell you, a lot of that is childcare. Childcare is extremely expensive in this county. The problem that we have is even though many of the benefits provide for multiples within that federal poverty level, so maybe 175% of the federal poverty level, people lose benefits before they can really be financially stable. And so part of the challenge is, what do we do? So an raise means that you begin to lose your benefits before you can really stay afloat. How do we make up for the loss of food stamps and health benefits and child care? How do we prevent people from falling off what we call the benefits cliff? There's no easy answer to this. I don't think there's one solution. The state of Maryland has done something which is very positive and unusual, which is to allow people to begin to have savings, have some assets that they can rely on. That's not counted against them. But there's some other things we can look at. Can we gradually decrease benefits? So we give a little bit more room for people. Can we have benefit transition navigators who can work with folks to get connected to other resources within the community that might help to keep them afloat? And can we align the timeline so people aren't losing all their benefits at once? We want people to move up that income ladder, but we have to make it possible to do so. There are people all the time, and employers will tell you, who turn down raises or promotions because it means they're going to lose their benefits, and they do not know how they're going to bridge that benefits cliff. So it's a real issue. It's something we need to attend to. And now, after my brief, and I'm sure it was more than 5 minutes, I was not looking at the person with the card. She's got the red one up for me. I'm going to turn it over, and we're going to have our 5 minutes. We are very fortunate to have Tracy Novak, who's Director of Population Health Programs for Howard County General Hospital, and Glenn Schneider, who's the Senior Program Officer for the Horizon Foundation.
Good morning, everybody.
Good morning.
All right, so 5 minutes, right? Here we go. I have great news for you. The biggest news I have to tell you is that the folks that care about health in this community have been meeting for around the past 5 or 6 years to help come together, plan together, prioritize together. Through the Local Health Improvement Coalition, 70 organizations belong to this, meet rather regularly. have come up with priorities. And what does that mean for all of us? It means that the anchor institutions that have the most resources are sharing similar goals, work together very closely, and have a very good working relationship. That's good for health in this community. It's important for you to know as we talk about the 3 important issues that we wanted to raise with you today. Number 1 issue, the bedrock to good health is making sure that you have coverage in order to make sure that you can stay well and be well even after an illness. So quality, affordable health care for all of our residents is an extremely important principle that we wanted to start with today. And because of the Affordable Care Act, great things have happened. We are now down to about 5% of our population that does not have health insurance coverage. That is big news because compared to a lot of other places around the state and the country, we are doing far better than most others. And it didn't happen just because of the Affordable Care Act. It happened because locally, we really spent a lot of time trying to find people who were eligible and getting them enrolled. That means that people have insurance of all kinds. Number 1 insurance for people is through their employer. But I will tell you, as you can see here, as our community has changed, the number of people that have been enrolled in Medicaid has gone up. So we have about 45,000 people who are in Medicaid. We have about 7,000 people who are now in the healthcare exchange, and that means that they couldn't get any other way to get healthcare. That's great for us. Why? Take a look at this. This is just Howard County General Hospital experience. This is uncompensated care that usually in the past was written off or included as part of everybody's premiums. That has dramatically gone down. That's just one of the non-health side effects that I think is important for us all to know and realize. In any case, we also know about our health care, and this is probably true of all of you too, when it comes to our benefit coverage. Sometimes you go, hey, I have great coverage, and sometimes you say, not so much. When it comes to behavioral health, which is mental health and substance abuse, and when it comes to oral health particularly, we don't have a lot of great coverage. And usually coverage that does exist costs a lot of money, a lot of co-pays, a lot of co-insurance. So keep that in mind because that comes into play with a lot of other issues in health. Next, I have to tell you, we have a lot of racial health disparities. Disparities that impact access, that also impact outcomes, that we really need to do a lot more with. I wanted to point them out to you. We'll talk more about them at the table. We have a number of policy suggestions. We'll talk more about these in depth at the table, but I will tell you this. Protecting Medicaid, particularly as the national healthcare debate explodes, will be really important. It is a lifeline for a lot of people in our community. It provides not only the important health benefits, but it also provides an economic security for families that otherwise wouldn't exist. Protecting Medicaid's big. Shoring up the exchange, making sure that we can offer a number of plans at a number of different price points, and that subsidies exist from the federal government to make those more affordable. Ensuring network adequacy. There's nothing more frustrating to have coverage than to find out that you can't find a provider that will see you. We've got to do a little bit better in making sure that the coverage exists and that it's good coverage and ensures that we have adequate networks. We have to make sure that providers are reimbursed properly. Unfortunately, particularly in mental health, substance abuse, even in some areas of oral health, we don't have great reimbursement for providers. We need to think about how we do that better. We need to add a comprehensive benefit to Medicaid. That's very important. Investing in behavioral health, as you will hear, we have a lot of gaps that we need to fill. We have a lot of other things that are important for us to invest in. And finally, when it comes to the county and the Board of Education, we've got to expand in-school access to mental health services particularly, and to make sure that the data that is being collected by the school system is adequately shared with folks who can use it. For example, the school system knows not only the number of students that are homeless, they also know where they live approximately. Sharing that in the aggregate with human service providers would help us be more efficient and effective. Second big priority is chronic disease. Let me just say that chronic disease is a big deal here in our community because why? Because we have bucks and brains. We have one of the most affluent populations here in the country. We also have a very high educational attainment because of these two things. We should be doing fantastically better than everybody else. And the reality is we are not. So a couple things. We have the same number of people who are dying from chronic disease as everyone else, more than half of our population. We are suffering from the same diseases as everyone else all over the place. The percentage of people at a healthy weight has declined over time. That has led to a lot of racial disparities in health as well. All of these things are not going to be new to you, but we have 4 key risk factors: healthy diet, lack of exercise, excess weight, and smoking that contribute to this. Policies that change that are really important. So I just want to quickly tell you, and again we'll talk more at the tables. Number one thing you can do when it comes to sugary drinks and tobacco is raise the price. You raise the price, consumption goes down. You can use whatever revenue comes in for very, very important public health things that will help reduce health problems. We know that preemption is a problem. State preemption, where you prevent localities from passing their own local laws, is popping up all around the country. You need to stop that sort of thing at the state level. We can talk more about that. We need to increase the budget for public health, which has been cut dramatically over the last decade. We can do better when it comes to providing the resources needed for public health to work. You got to reduce sugary drink consumption. It is an independent factor for not only weight, it's also an independent factor for diabetes and heart disease. We know that we have high numbers of people who are consuming sugar drinks, particularly kids. We can do better to make our community bikeable and walkable. In fact, we don't invest a whole lot here at the county level. If you're a county level person, be thinking of the fact that we are dramatically underinvesting in biking and walking compared to our neighbors, and it's going to have an impact not only on health but on jobs. If you are a member of our future Board of Education, you should know that we should continue to be implementing our wonderful, well-lauded wellness policy. We have a lot more to go, but there's a lot we can do to continue to implement that. And then finally here, when it comes to the hospital, I'm going to hand it over to Tracy.
Great, thank you guys. I don't have a lot of flashy slides, so bear with me. We, at the hospital, we'd like to ask the state and the county to continue to support the hospital in terms of operating and capital funds. As you all know, health is really important and critical for building a strong and safe Howard County community. Our hospital, Howard County General Hospital, is the only hospital in the county, and it's growing and aging at twice the state average. Howard County, the hospital is not right-sized for the community that we serve, but we also work really hard to keep people healthy and well in their community. And the hospital has made a new investment in population health. That's the work that I direct. So we're really doing everything that we can to keep people healthy and well in their community and out of the hospital, which is, again, a new initiative for the hospital. The regulations are different in the state of Maryland related to how hospitals are paid, and Maryland is the only state where we have what we call a Medicare waiver, where the Medicare payment rules are different for hospitals in the state of Maryland. We'll talk more about that at the table. But what that means, though, is that the hospital is no longer paid on a volume basis. It's paid annually, and the revenue is capped at a per person level. So we're limited in what we can do in terms of additional funding. That's why continued state and county investment is so important. As a nonprofit, our hospital is a partner in care with many of the other entities that Glenn mentioned, including the health department, school system, etc. This slide just points out the growing ingrained that Joan mentioned of the county. And as the population ages, the burden on chronic disease and disability grow, which with this booming aging population really emphasizes the need that we must invest in the population health programs, again, to keep people healthy and well in their community. And then what are we asking for you to do? At the state and county level, we're asking for capital funding for the hospital through the bond programs or other county support. We're asking for your support for a fully integrated health system to fund behavioral services and other medical services that will help us to continue to increase access to care for patients that come to our ED, as well as other behavioral health efforts that we know are necessary within the community. We ask you to support an expansion of the Medicaid coverage for telemedicine. We ask you to oppose changes to current laws that prohibit physicians from self-referrals. That means referring patients to centers where they may have investments or a conflict of interest in terms of support for creation of a no-fault birth injury fund. And again, we'll talk more about all of these issues at our table. I will now hand it over to Sheila, who's going to talk about workforce development.
Independently wealthy, I was not, and there are a lot of people who are not. The middle skill job in Howard County, in our region, Baltimore, Anne Arundel, Baltimore County, is something that there is a need for additional. There's an additional need for middle skill supporting jobs. That means jobs that require more than a high school education, less than a college degree. With that being said, a certification would take care of that. These are jobs that would lead to a family supporting wage of $22.28 an hour. Joan showed you some other figures earlier, but this is from the Baltimore Metropolitan Council's regional study. So $22.28 an hour. A lot of minimum wage jobs in retail are paying $10.10 an hour. So look at the difference. In-demand family supporting occupations between 2016 and 2026, heavy and tractor trailer truck drivers. There are more and more companies needing people with that particular skill set, but an individual needs to have a driver's license in order to do that, and then a tractor trailer license. Training for that will cost somewhere around $4,000. There's a $90 cost just to get the permit. Bookkeepers, accountants, and the trades. The trades are the areas where not a lot of high school kids are interested in working in now. It's because it's not glamorous. Who wants to plumb, clean the toilet? So, or fix it rather. These jobs are the jobs that a low-wage worker can obtain with additional training. So that person earning $10.10 an hour, if they can get the training for a tractor trailer truck driver, they can then increase their starting salary to around $40,000, $45,000 per year. Let's see if I press the right button. Apprenticeships. Apprenticeships is a very underused model in Howard County, and I think across the state. But there is a great effort to increase it. Howard County government, for example, has the apprenticeship model. They're trying to fill their HVAC positions using this model. It's a learn while you earn model, and many of you are probably familiar with this. I'm not telling you what you don't already know, but it is something that I think will allow those folk who, North Carolina here, those folk who do not earn enough money to sustain their households, to support their kids, to give their kids what you may be able to give your kids. So, apprenticeships are not limited to the trades. Wages increase at a predetermined benchmark. So if a person starts out and they're doing classroom instruction, they're hired by an employer, they might start out at $12.50 an hour. But once they meet that first benchmark, they might go to $15 and then beyond. It generally takes about 4 years if you're thinking about the trades to become a journeyman. But a hotel desk clerk can work as an apprentice to move up to become a hotel manager. So that's something that's new. I'm getting the yellow card. So, childcare. Childcare is something that Joan talked about. Everybody knows about the high cost of childcare. Infants, $19,150 per year. 2 to 4-year-olds, $13,555. School-age children, $6,502. Again, that person who is earning $10.10 an hour, they can't do it. The unemployment rate in Howard County is low, around 3%. But the folks not being counted in that are those people who can't afford to work. who hit that benefits cliff will stop. So unaffordable childcare affects the business community and has a significant impact on workforce participation, and it drains the economy. So how can you help? This is how you can help. Some individuals working low-wage jobs may not be eligible for federally funded training. That just means we need to make sure that everybody can participate. Strengthen the region's economy by securing Howard County's share of family supporting jobs. Encourage businesses to apply for funding for the new apprenticeship model. Continue to support the state apprenticeship model. Continue expanding after-school care, and that then will give us the freedom for the parent to work. Encourage businesses to create child care facilities, and support continued funding for Head Start, and introduce early Head Start. I just want to say, think about what is needed. Think about the folk who are here in our county who are not doing as well as everyone else. Thank you.
Thank you.
I forgot to introduce Joe.
It's Grace, or Joe.
Grace and Joe, so Grace is first. Sorry about
That's
that.
okay. I go the right way. Okay, so good morning again. We're going to speak with you, this is our last topic before we do the breakouts, on the lack of affordable housing here in Howard County. And I know that with a lot of the things going on these days in terms of APFO and school overcrowding, that affordable housing has been really talked about a lot. And we want to just share some information with you and again encourage you to come and speak with us at the roundtable. We know that a lot of people feel, I shouldn't say a lot of people, but some people feel that if you can't afford to live here, then you can't afford to live here. And that's a notion that we really want to dispel. We need people of all income brackets, of all job skill levels, as Sheila was just talking about, to be part of our community. It's really important, and it has an impact on all of us. People are on the roads that don't need to be on the roads. People are commuting from far distances to come here. They have their children in childcare for long hours, and there's a variety of impact on lifestyles and people's quality of life when they have to commute from far distances. So there's really an effect on all of us that we want to talk to you about a little bit more in depth when we're at the housing table. I'm going to just speak with you a little bit about renters, actually. So when we say a home is out of reach, we're not even talking about home ownership. We're really focusing this morning a little bit on renters. So 27% of the households here in Howard County are renters. That's about 29,000 people. Of those, 33% have incomes that are below $50,000. So by our estimates, there's a 6,600 unit shortfall in rental homes that would be affordable. In 2018, the mean wage for Howard County households that rent a home is $19.98. At this wage, which is clearly above minimum wage, which is $10.10, the most affordable unit for them without paying more than 30% of their income towards rent would be $1,039. We just did some brief research, and on a site called Rent Cafe on 910, the least expensive one-bedroom unit was $1,066. So you can easily see that just a basic one-bedroom unit is out of reach for people that are earning nearly double what minimum wage is in our county. The maximum monthly rent that someone can earn who is, that someone can't pay, who is earning the minimum wage is $525. The cheapest studio apartment is $918. The lack of affordable housing also has a detrimental effect on our vulnerable populations, our children, our seniors, and the disabled. As I think was mentioned earlier, in Howard County Public School System in May of this year, 540 children were identified from 235 families as being homeless or experiencing what we call housing instability, and that means that they're at risk of homelessness. Our senior population, as you've heard, is growing. Right now, those comprise 13.4% of the Howard County population, and 4.8% of those live below the poverty line. So in the state of Maryland, based on April data from the Social Security Administration, average senior receives $1,482 a month, which means they can afford a rent no higher than $422 without, again, being rent burdened, meaning they're paying more than 30% of their income towards their rent. And our disability population, there's 22,089 individuals, according to the Maryland Department of Disabilities who are on a waiting list, who want to live in Howard County, and they're waiting for project-based housing. And there's no funding for that housing to even be developed at this point. 140 of those are from Howard County currently and are waiting for project-based rental assistance. So I'm going to introduce Joe Wilmot. He's going to speak to you a little bit about homelessness. And Joe is a wonderful community advocate. He's very active in a variety of organizations, right? I'll let him tell you a little bit more about himself. He's got a lot to say. Thank you, Joe.
Thank you.
Good morning.
Good morning.
Despite our affluence in Howard County, more than 200 persons each day are homeless, and about an equal number are in unstable housing and at risk of homelessness. As Grace mentioned, part of this includes 540 students homeless or at risk, as counted by the public school system. Homeless students are twice as likely to repeat a grade, twice as likely to experience food insecurity as other students. And we have between 330 and 430 households evicted each year for the past 8 years. The characteristics of the homeless population are in two categories. One is situational homeless, those who are temporary or short-term homeless due to adverse events such as loss of income, sudden expenses, particularly medical or major car repairs, temporary disability, abandonment by a partner, or fleeing domestic violence. Often these conditions occur in combination. That's 85% of our homeless households. The other 15% is chronic long-term homeless, usually suffering from addictions or mental illness, and in some cases living outdoors. In all cases, the lack of affordable housing makes it difficult for these households to obtain and retain housing. Now, there are some things we can do about our lack of affordable housing. We create a task force focused on ways to house the county's 540 homeless students. And these students are already in school, so providing this housing doesn't impact our school crowding situation. We can increase affordable housing development requirements through the upcoming rewrite of the county zoning code. We can strengthen the moderate income housing unit program, including the fee and lieu component to finance affordable housing. And we expand development fees, excise taxes, and transfer taxes to finance affordable housing. We can establish a local housing trust fund. We could fully fund the soon-to-be-updated plan to end homelessness, which was introduced in 2011 and developed a coordinated system of homeless services that has been quite effective, but is underfunded. In fiscal year 2018, 857 households were referred to the system, but it only had resources to serve 520, about 60%. Update to the plan is expected in November, and we, as a community, we need to put the financial support into that plan. Who's next?
Next. Great, thank you, Joe. So all of this will be available on our website. I'm going to send each of you a link. It has all of these materials and some additional as well as contact information, and hopefully we have a video of this presentation. Now, what I would like you to do is to think about what your priorities are. We have 3 tables in the back. One is housing, one is health, and one is employability, where we're going to talk about transportation, we're going to talk about childcare, and we have experts, both your presenters as well as some other people from our Public Policy Committee there to talk about these issues. We're going to have 20 minutes at 2 tables, so you're going to have to choose 2. So we will tell you after 20 minutes to move. And we would like to ask you to make your selections now, and we will start the discussion.